In the third section, now we will talk about the polymerase chain reaction, serological studies, and some other lab findings that can be performed for the diagnosis of the viral meningitis. Polymerase chain reaction amplification. Amplification of viral specific DNA or RNA. Enteroviral and herpes simplex viral infections can be diagnosed by the polymerase chain reaction amplification. Polymerase chain reaction used and more sensitive than viral cultures. So sometimes when the CSF examination and viral cultures are not helpful for the diagnosis, some other tests like polymerase chain reaction can be used for the diagnosis in which of the like enteroviruses and herpes simplex virus infection, in which we can use the amplification of viral specific DNA and RNA. Herpes simplex virus cerebrospinal fluid polymerase chain reaction, those with recurrent episodes of aseptic meningitis. So patients who present with recurrent, they keep on having episodes of aseptic meningitis, we should diagnose by the polymerase chain reaction. Many have amplifiable herpes simplex virus DNA in cerebrospinal fluid, despite negative viral culture. So it's very specific, more sensitive as compared to viral culture. Even in patients who have negative viral culture, when polymerase chain reaction is performed, they show the polymerase viral specific DNA in the cerebrospinal fluid. So it's very, very sensitive test in the diagnosis of the meningitis. Diagnosis of central nervous system viral infections by cytomegalovirus, Epstein-Barr virus, varicella-zoster virus, and HIV-6. Human herpes virus 6, herpes simplex virus type 6. So all these are different viruses that can be diagnosed with the help of polymerase chain reaction amplification. We have CMV, cytomegalovirus, Epstein-Barr virus, varicella-zoster virus, herpes, human herpes virus type 6. Again, polymerase chain reaction amplification is in the diagnosis of central nervous system infection, including meningitis. Meningitis is a type of central nervous system infection we have due to Mycoplasma pneumoniae. So some microorganisms other than the viruses can also be diagnosed by the polymerase chain reaction amplification, like Mycoplasma pneumoniae. It mimics viral meningitis. Polymerase chain reaction of throat washings is done for diagnosis of enteroviral and Mycoplasma infections. Stool specimens is done in the diagnosis of enteroviral infections. Now, this chart gives us a very good, clear picture of why we use polymerase chain reaction test. Polymerase chain reaction is done for the diagnosis of some infections caused by the viruses along with some other organism like Mycoplasma pneumoniae. It's done in we can get these samples from the throat washings and also from the stool specimen. And it helps in the diagnosis of enteroviruses, cytomegaloviruses, and Mycoplasma pneumonia. Next, some serological studies for the diagnosis. Serological studies done on the serum for many arbovirus infections, including Nile virus. Serum antibody determination for the Nile virus. Antibodies are detected. If antibodies are present, it means there was infection by the Nile virus. Less useful for viruses with high seroprevalence. Herpes simplex, varicella-zoster, cytomegalovirus, Epstein-Barr virus. Viruses with low seroprevalence rate, they are more effective. Seroconversion between acute phase and convalescent sera. Presence of virus-specific IgM antibodies. So serum anti-determination is done in serological studies that gives if they are less useful in viruses with high seroprevalence and like herpes simplex virus, varicella-zoster, cytomegalo, and Epstein-Barr virus. And antibodies are detected in the serum that is gives the idea about the infection caused by different viruses. Virus with high seroprevalence, we have varicella-zoster virus, herpes simplex virus. They have very high seroprevalence. Demonstrating synthesis of virus-specific antibodies in cerebrospinal fluid, increased IgG index, presence of IgM antibodies, presumptive evidence of central nervous system infection, serum and CSF IgM persist for few months. So serological studies, basically, if we summarize this, is done to find out if antibodies, IgG and IgM in the serum. They are helpful in finding the infections caused by herpes simplex virus, varicella-zoster virus, cytomegalovirus, and we have antibodies, IgM and IgG antibodies present in the serum. In case of Epstein-Barr virus, demonstration of antibody responses consistent with recent acute infection. IgM viral capsid antibody is present. Antibody against early antigen. Absence of antibody against Epstein-Barr virus associated nuclear antigen assist in diagnosis. So that's helpful in the Epstein-Barr virus, in which we have IgM against the viral capsid antibody. Then CSF oligoclonal gamma globulin bands in association with viral infections are also present in different serological studies. Associated antibodies directed against viral proteins, oligoclonal bands in non-infectious neurological diseases or in non-viral infections. We have oligoclonal bands present. Some other lab studies, we have complete blood count and differential count. liver and renal function tests, ESR, erythrocyte sedimentation rate, C-reactive protein, which is one of the marker of the very high specific virus, electrolyte level, glucose and creatinine kinase level, and aldolase, amylase, lipase. So these are different lab tests that can be performed besides the cerebrospinal fluid examination, viral culture. Then we had some serological studies, polymerase chain reaction, and these are some other lab tests that can be performed. Some neuroimaging studies like MRI, which is preferable to CT scan, performed in patients with altered level of consciousness, seizures, focal neurologic signs or symptoms, atypical cerebrospinal fluid profile, and underlying immunocompromised treatments. So that was all about section 3. Thank you for watching sqadia.com.